So you've been working with physical therapy for 3 weeks now after your surgery, and you've been working mostly on range of motion and getting your muscles to fire. But now we're gonna bump things up and work on more muscle strengthening. The frequency of formal physical therapy during the second phase of rehab drops to twice a week, and then working on your home exercise program on the other days. Going into the second phase of the rehab process, I would expect you not to have very much pain at rest, but to be sore with higher levels of activity. So some soreness is common, but that sharp pain that you may have been experiencing before surgery is really gone. The goals of phase 2 really are building on those of phase 1, and you'll be working more on strengthening your hip girdle and your core muscles and starting to do strengthening against gravity or using your own body weight for strengthening exercises. My hope is that the range of motion starting at that third week is normal or near normal with relatively pain-free arc of motion at that point. The focus of the second phase of rehab is working on your glutes and your core muscles. And those are the major hip stabilizing muscles in the body. And if you can build those, then that really helps restore the normal gait pattern and motion pattern of the hip muscles. It is common during this phase to overdo it a little bit, and patients will often feel like hip flexor pain or pain in the front of their hip. And if that starts to develop, I really encourage patients to stretch the front of their hip and work on strengthening their glutes or their butt muscles more.